Welcome to another Counselor Soapbox video. This episode, Learning About Alcohol Part 19, covers individualizing professional treatment, an overview of alcoholism and drug treatment. In counseling, it's important to get a picture of the client's life story. In substance use counseling, we begin by taking a substance use history. For those who work in mental health, that may be part of the comprehensive diagnostic inventory that's done using the Diagnostic and Statistical Manual. For those who work in substance abuse counseling, this is often done using the ASI, or Addiction Severity Index. Other instruments can be used, including the ASAM, American Society of Addiction Medicine, patient placement criteria, and a great many other instruments may be used. Sometimes substance use history is done as a timeline. How old were they when they first began to use drugs or alcohol? What was the first thing they used? What was the next drug? And were there any periods in which they were abstinent from drugs and alcohol? Or has their use been continuous since they first used? Part of the process of becoming a counselor is learning what to ask, but also how to ask those questions. It's common to do assessments when clients enter treatment, and it's important to get the information correctly. The word assessment has two different meanings. Sometimes it refers to a particular piece of paperwork or instrument that's used, and other times the word assessment refers to the process of getting the information. There are several ways in which this may be done. Three principal types of assessment instruments are used. One is a structured assessment instrument, such as the MMPI-2, the Minnesota Multiphasic Inventory, in which the client is asked about over 500 different multiple choice questions, and then it can be machine scored. There are semi-structured inventories, such as the Addiction Severity Index, in which you have a set of questions, but when you get a yes question, you may follow it up with additional questions which are not on the inventory. In supervising drug and alcohol counselors, I have noticed that the best inventories, the best assessments done using the ASI, are the ones in which the counselor got a great deal of additional information, and that is reflected in the comment section. It's also possible to do an unstructured interview, such as a clinical interview, in which you simply have a conversation with the client and then go back and ask a few questions to fill in missing information. This is probably more useful in emergency settings where the need is to very quickly come to a conclusion about what the possible problem is and what might need to be done. When we talk about drug treatment, it's important to think about the concept of modality. Modality is the way in which a program or organization organizes the treatment they provide. This could include elements such as hospitalization, residential treatment, often referred to as rehab, outpatient treatment, individual therapy. Sometimes clients are required to attend outside self-help groups, such as 12-step groups. Some programs include an element of harm reduction, as in trying to get a person in drug or alcohol treatment to also reduce the amount of cigarettes that they are consuming. Notice that programs can vary the number of elements or the involvement. Someone might go to the hospital first and then to residential rehab. After residential rehab, they could go to a sober living facility and have outpatient. Outpatient could be 4 hours a day, or it could be 1 hour once a week. Lots of variations here. But each program will put together a mix of services that they think would be helpful to their client. As we move on in this section on treatment, we'll revisit the idea of various modalities and what can and cannot be done in them. Within a treatment, regardless of the modality used to deliver it, there's content. This content can involve a great many different things, and counselors over time learn to do these various types of content delivery. One can be education. This could be education about drugs and alcohol, or psychoeducation about emotions, thinking, feeling, and behaving. Part of the content may be self-awareness and having the client learn about their own things, such as what triggers drug use. There's a thing called process or therapy. In the process, people look at the way in which they talk and think. Therapy can involve a great many specific skills, but it's the idea of interacting with the client in an effort to help them see their problems and to look at it in a different way. Often, drug and alcohol treatment programs include a great deal of life skills. During the process of alcoholism or addiction, lives often become chaotic and unmanageable. So life skills could include structure, when you get up, when you go to bed, things like time management, could include things like financial, housing, job training, and so on. A significant part of most treatment programs is relapse prevention. It's not terribly efficient if people get off the drugs but can only stay clean and sober while they are in treatment. And so they need to learn how to handle temptation, urges, and cravings, and prevent relapse. Relationships, just like finances, are a significant cause of many relapses. And so some of the content may be related to family relationships or friendships and how those might increase or put sobriety at risk. There are issues that may come up in treatment, and counselors need to develop the skills to be able to work with this. Clients often lack life skills, so that lack of skill in managing life may be an issue that interferes with their drug treatment. Many people have cognitive distortions, or sometimes called unhelpful thoughts. They think of themselves as either all good or all bad, and therefore if they make one mistake, this means they're a failure. Addressing those unhelpful thoughts is an important part of treatment. Also, memories may be significantly distorted as a result of drug and alcohol use, and so there is a need to go back and look at those memories and adjust them. People may have been in blackouts from alcohol and may have times where they have no memory, despite the fact that other people remember what they did. There's also a phenomena called confabulation, in which when the alcoholic doesn't remember certain events, the brain brings up memories from another time or place and fills in the gaps. Often, the client believes what they're saying, but may in fact have deceived themselves through their continual telling of stories, lying, or simply not remembering things accurately. Other issues that may come up in treatment: emotional regulation. When people are using drugs and alcohol, they often don't feel what they're feeling. Many people are basically illiterate when it comes to feelings and emotions. And without the drugs and alcohol in their system, they may experience an emotional roller coaster, being extremely happy one moment and being sad another. Often they don't know what they're feeling and have a disorder we call alexithymia, which is, I don't know what I'm feeling, and even if I did, I wouldn't have a word to describe it or know what I want to do with that feeling. Another issue we often call denial, which is minimizing or trying to avoid the idea that they are an alcoholic or drug addict. People will often say, well, I just enjoy it. I like to do this. There's often a huge increase in anxiety during treatment, and people often have been lying to themselves so often and to others that they no longer know what the truth is. So they use the lying often as a way of deceiving themselves as well as others. Another important topic covered in treatment is relapse prevention, and there's a technology for preventing relapse. Often, it's tempting to look at why they drink, childhood experiences and emotional issues and hardships. But knowing why you drink is not necessarily a help in not doing it. In current thinking, relapse into active use is seen as a failure to do maintenance in the stages of change model, and we'll talk more about that model in other places. But once people are able to give up drugs and alcohol, they need to do active steps to maintain this new clean and sober, recovered lifestyle. In talking about drug and alcohol treatment, what the counselor does and what the client can expect, it's important to ask ourselves what makes treatment work. One of the main things that makes drug and alcohol counseling, or any kind of counseling, effective is the client's belief that the counselor can help them. If they come into the situation not believing that this program will benefit them, it's probably not going to. So it's important for the counselor to spend some time developing a collaborative, cooperative relationship with the client. We don't need to always have long-term treatment. Sometimes one session helping the client to develop a plan for what they want to do can be very effective. The minimum amount of treatment that's been shown to be effective is one session. On the other hand, many studies have shown that more time in treatment may be very helpful. The days when we could say everyone needed a 28 or 30-day rehab have passed. Now we know that different people may need different lengths of time and intensity. Still, research tells us that the longer someone stays connected to supports for their clean and sober lifestyle, the more likely they are to be successful. People who stay connected to treatment, even if it's only monthly alumni groups for up to 5 years, have very low rates of relapse compared to people who go through a short, brief treatment and then have no more connection. It's important that counselors working in the program stick to the script. It's tempting to bring in a lot of material from various self-help things, but early in recovery, the recovering person needs a very consistent message and to cover the basics sufficiently that those become new automatic behavior. Treatment does need to be individualized. Not every person in recovery has the same issues they need to deal with. And various counselors may work better with various clients. The counselor is a person, and they have certain interpersonal styles. What may work between one counselor and patient may well not work between another counselor and their client. What's ahead for the Counselor Soapbox video channel? More learning about alcohol videos, more drug education videos, and some mental health and wellness videos. If you've enjoyed this video, please click the like button directly below and subscribe to receive new videos as they are completed. For more information, please visit the Counselorssoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.